Hi there, I'm having some itchy skin, and oh no, it seems like it's covered with rashes and hives. Looks like you're having an allergic reaction. My body's a bit red too. Can I ask you a question? Yes, go on. So, how did my body get these allergic reactions? Well, this is all caused by the release of histamine in your body. To understand all this, you must know about the immune system, the body's lines of defense against foreign invaders such as bacteria. In some cases, some people's immune systems may identify and perceive certain allergens such as dust and pollen to be harmful, even though they actually are harmless. This perception of these allergens being harmful then alerts your body to release chemicals called histamine. Histamine then binds onto histamine receptors, and our body has 4 histamine receptors. When histamine binds onto histamine receptors, this then triggers what we know as an allergic reaction, which can cause hives, insect bite reactions, and sometimes airway constrictions, especially those with asthma. When histamine binds onto histamine receptors, it causes a decrease in blood pressure and an increase in the body's heart rate. This is because histamine dilates or widens blood vessels in the capillaries, and thus the heart tries to pump faster to allow more blood to flow around the body, increasing the blood pressure as a feedback response. Wow, thanks for that explanation. Now, what medication should I take? At this moment, I suggest we start out with a few over-the-counter medications first. If there are no improvements, then I suggest you visit a doctor and get help from there. Is that okay with you? Yes, that's fine. Specifically, what kind of OTC medications can I take so far? You would take either loratadine, cetirizine, or diphenhydramine. Just take note that special precautions should be taken when taking loratadine, and it is best to still consult your doctor anyhow. So, what about these options? I think we should dive into more detail. Maybe let's start with diphenhydramine. Okay. Diphenhydramine or Benadryl is a first-generation antihistamine. Like all other kinds of antihistamines, diphenhydramine blocks histamine receptors by competing against histamine. As I said earlier, when histamine binds to histamine receptors, it triggers an allergic reaction. If somehow the histamine antagonist found in the antihistamine drug binds to the histamine receptor before the histamine binds to the histamine receptor, it prevents histamine from binding and thus prevents allergic reactions. Obviously, not all antihistamines, or maybe even all antihistamines, do not completely block all histamine receptors, but this at least means a much reduced allergic reaction in terms of the presentation of symptoms. Now, what should I note? Now, you should take note that diphenhydramine, like all first-generation antihistamines, have sedative effects. Diphenhydramine specifically competes against histamine for H1 binding sites in the effector cells found in the blood vessels, digestive passage, and the respiratory passage. When it comes to its bioavailability, the percentage of the initial dose successfully reaching the site of intended action, diphenhydramine has a bioavailability of about 42 to 62% when taken orally. So I see. How can you take the medicine? So when it comes to oral administration, when you take it by the mouth in terms of tablet form or capsules, it generally takes between an hour to 4 hours until the drug reaches its maximum effect. Isoenzymes found in the liver then chemically break down the drug. The drug is then widely distributed around the body and the central nervous system, and it can cross the placenta and enter breast milk. Specific isoenzymes found in the liver are then responsible for chemically breaking down the drugs and converting them into substances that can be eliminated and excreted more easily from the body. Then diphenhydramine is then excreted through urine, and its half-life, which is the time taken for the drug to reduce by half of its original amount, is about 2 to 9 hours. However, the drug may also be applied topically, or sort of like instead of like in a term of like lotions over your skin. When taken in through the mouth, diphenhydramine can be used to treat motion sickness and hay fever. Meanwhile, when diphenhydramine is applied on the skin as an ointment or lotion, it can treat hives and rashes. For both oral and topical administrations, there are no requirements to whether you have to take the drug before or after meals. Diphenhydramine is not suitable for those with stomach ulcers, gastrointestinal obstructions, infants below a month old, those who are breastfeeding or taking other antihistamines at the same time. As diphenhydramine is a first-generation antihistamine, it does have sedative effects. As a result, some of the adverse effects can be or include fatigue, drowsiness, and other sort of sedative effects like sleepiness. Furthermore, diphenhydramine when used continuously can build up drug tolerance. Okay, thanks a lot for your explanation. Next, Now, the next antihistamine I would like to explain to you is cetirizine. Cetirizine is a second-generation antihistamine, which means that it has little or no sedative effects at all. Cetirizine inhibits histamine receptors in the digestive passage, blood vessels, and respiratory passage. It prevents histamine from binding onto histamine receptors, which means that it could significantly reduce the symptoms or effects of an ongoing allergic reaction. It is taken in or ingested through the mouth and may be taken without meals, and is used to treat allergy-related stuffy nose, hay fever, and unexplained hives. When taken orally, it generally takes about an hour to reach its maximum effect, and is excreted through both urine and feces for a 10-hour half-life. Some side effects some people may experience include gastrointestinal discomfort, dizziness, and headaches, just to name a few. You should never take the drug with alcohol, and if you have severe kidney or urinary tract impairments, you should not take it. If you do not have severe kidney or urinary tract impairments, you should still consult and ask your doctor if it's still safe to take cetirizine. Okay. Now, this drug is called loratadine, and it is a second-generation antihistamine, which means that it has little or no sedative effects. Loratadine is a long-lasting effect type of antihistamine that selectively blocks histamine receptors on the effector cells, which hence prevents histamine from binding onto the histamine receptors, which results in a reduced allergic reaction effect or symptoms. Loratadine relieves symptoms of hay fever, chronic hives, and skin-related allergies, for example, rash. Loratadine can be taken through the mouth and can be taken without meals. When taken in through the mouth, it takes about 60 to 90 minutes to reach its maximum effect. When loratadine is distributed through the body, it can enter breast milk. Hence, pregnant or breastfeeding women should not take loratadine because it can pass on to their fetuses, or the baby that's sort of in the womb, basically. It is metabolized by isoenzymes in the liver, and it's removed or excreted from the body through urine and feces. It has a half-life between 8.4 to 10 hours. Those with severe liver impairment, children, pregnant or breastfeeding women or those with severe kidney impairment should take special precaution with the drug. Some people may experience side effects such as headaches, drowsiness, low blood pressure, nausea, or vomiting, though this does not always happen to everybody. Alright, thank you very much for your explanation. It was a great pleasure. Goodbye. Goodbye.